Go back to another of our earlier stories, the situation in the Western Cape, where hospitals are under pressure from rising COVID-19 patient numbers. That's put strain on ICU sections and other crucial resources. By Friday, there were more than 2,000 COVID-19 patients at hospitals in the Western Cape. To get you more detail on the situation, I'm joined on the line by Dr. Saadiq Kariem. He's with the Western Cape Health Department. Dr. Kariem, grateful for your time tonight. So we're speaking about these numbers, this 2,000 patient figure. By Friday, when did the situation become so desperate?
What we've been seeing is probably a snowballing effect of the exponential rise in cases over the last few days. So to give you some example of those numbers, on Saturday, we recorded the highest ever number of new cases that we've had, even surpassing the number that we had in the first peak during June. We had 4,602 new cases on Saturday alone. And thus far, in the last 24 hours, we've recorded 2,335 new cases already. So we're really beginning to see that snowballing effect now of that exponential rise in cases. Yesterday, for example, just to update that number, by yesterday, we had 2,500 people admitted across our hospitals in the public and private sectors in the province.
And how many of the 2,500 patients are in the worst condition?
Well, look, of those, obviously, the ones that are in the worst condition are the ones that are in critical care. And at the moment, it's roughly about 200 that we see across the province in critical care at the moment. And obviously, those are patients who also require oxygen therapy.
You said 200. Is that number right, sir?
Let me just check that. I'll give you the number in a minute again.
Okay, because I had seen in your statement, that's fine, doctor, just stay with me. You had said about 231 adult ICU beds are currently...
231.
You had said 231 adult ICU beds were currently fluctuating between 80 and 100% daily capacity, right? So those beds now boosted to about 367 in terms of availability.
Yes,
do you predict then that you may have to get more beds over and above the 367?
Well, we hope that we won't have to, but we probably would have to. We've opened additional critical care beds in the last few days at Groote Hospital. So already we've managed to open 12 additional critical care beds. And obviously we'll have to just titrate that number depending on the clinical condition of people.
And like with other provinces, what you're seeing now is a steep increase in non-COVID related trauma admissions at your hospitals. What is driving that? Is it drunken behavior and people becoming ill at many of the festive season gatherings?
We definitely, absolutely. And I mean, unfortunately, it's the festive season, it's holiday mode, people are still drinking, there's still lots of road traffic accidents, there's lots of interpersonal violence. And unfortunately, all of those contributed to the significant increase in our hospital admissions. So over the weekend, for example, we still have a number of patients that need to be admitted as a result of trauma. And it's just wanton behavior. People have become, I suppose, more lax about their behavior during the festive season, contributed by alcohol that's probably still freely available. And that combination is just an explosive situation.
I'm curious, doctor, about the people who are admitted to hospital with other ailments and then later find out that they are indeed COVID positive. Are you seeing a lot of that?
We are, and we're finding out that people who come in because we've been trying to upscale our normal services because people require urgent care for other conditions. We admit them, and obviously we find out sometimes afterwards that they're COVID positive. Having said that, we do require that people, before they get admitted to hospital, have to have a COVID negative test to try and make sure that obviously as far as possible we minimize the risk.
And we've been hearing in the past few days anecdotal evidence of patients in the Eastern Cape, which we know is also battling quite a serious number of COVID-19 admissions and infections. People there saying that, look, we're taking our ill loved ones to seek medical attention in KZN, for example, where there's less pressure on the healthcare system. At what point would you in the Western Cape say you would seek help from neighbouring provinces to deal perhaps with patients who aren't down with COVID?
So at the moment we are managing we're probably at or near our capacity. We haven't breached our capacity yet. I guess when we do, and when we do breach our capacity, that will be the time to consider that. But having said that, we are bringing online an additional 263 call it field hospital beds inside our existing facilities to help cope and ease the tension and the pressure on the service platform. And those beds will come online within the next few days. In fact, we opened today the first tranche of those beds already.
Dr. Saadiq Kariem, good to speak to you. He's with the Western Cape Department of Health, speaking to us there about a system that is becoming severely under pressure as a result of COVID-19 admissions.